This is a patient that has been suffering enamel erosion, and it appears to be from gastric reflux. That is an implant on the first molar there, by the way, number 19. And you can see the two teeth in front as well, the premolar and the two premolars, and that's the natural side. A little bit of wear on the teeth. And back. Right through here and there, but nothing significant. This is the implant. Now when we go over to the other side, you can see how there's been erosion acid that's been getting in here and wearing down the teeth. Our laser determined that there was decay right here, the cavodiagnodet. And you'll see a little close-up of the spot in question where the erosion occurred. There's no way that opposing tooth can get up inside there. Something has been eating away at the inside here. And then you can also see the same things occurring here, where you can see the gold that's up underneath there, and possibly some tooth discoloration. And the patient is not aware of having any gastric reflux, and she hasn't been doing any other habits that might cause erosion, like lemons, limes, grapefruits. You can see the little spots here the normal instrument wouldn't have picked up, but the cavodiagnodet does. See a little bit of wear on the gold margin. So she definitely, over time, has worn down her teeth. Has a history of grinding her teeth. But it's just not in the spots that we've been talking about. Nothing too amazing there. There's the wearing away of the enamel on the outside. And typically when someone sleeps on one side and the saliva pools, it can pool in certain areas and the acid just eats away at the teeth. Another possibility would be brushing, but typically it would be a different type of stroke there. And she doesn't use an electric brush or anything that would allow us to think that was the case. And when we look at back molars, old silver fillings, it's a crown. For the premolar that we're going to be looking at right here, you can see where that too has been eaten away by some sort of acid, and so also leads us to believe that it's acid reflux. She's not doing any carbonated beverages either. The same basic hollowing out of the tooth. This is the other side, and you see just a little bit of it right here. This is wear from grinding, and then she's got another little spot that will be coming up shortly. But those areas of tooth resorption, they got just some staining, a little broken down fillings, nothing too just some stain there. The laser didn't see that as a problem. This, on the other hand, has been wearing away at the enamel of the teeth. And here's the filling where we just started doing some of the work. And you can see the bigger spots that were done. This wasn't drilled on at all. You'll see that in just a minute. looking in the mirror, you'll see the areas of decay. And it goes down to 2 millimeters by the time we're finished. And that's after we've drilled it out a little bit more. You'll actually see the drill go in and clean that up. And the filling is done that way. And you can see the whole head of the 330, which is 2 millimeters. Actually, it's 1.8. It is in the area where the decay is, but we haven't replaced anything else. And we're going to go ahead and put some tooth detector, decay detector, and we rinse that off. See if there's any decay. If you notice that it was just a little bit of a crack on the distal there. But it doesn't go into the dental area. And there's no other cavities, and the decay detector doesn't stay there. So we clean out the little spots of active bacteria. We'll see that in just a second here. You see a little bit of decay in this area. Clean that up. And we're going to clean that little groove just a little bit more. And most dentists don't use a microscope to do the work. They aren't able to see things 20 times bigger like this. I use this routinely in my office. My name is Dr. Craig S. Kohler. I'm in Wilmette, Illinois. You can learn more about my practice at kohlerdentistry.com. And there's the tooth cleaned out. And as you can see, the depth of the actual cavities is the same color as the depth of the erosion. So the erosion was pretty significant. Let's clean that up just a little bit more. And there's the filling, and as you can see, we've filled in the areas, the whole outer aspect of the tooth as well, all the way up to the buccal area. And the reason for that is to so that the gastric reflux or whatever causes the erosion will just be touching the tooth, the colored material, and not eat away at the enamel, not like this area over here. And we were able to use the Filtex Supreme by 3, Filtex Supreme Plus by 3M to do this. And as you can tell, you can't even see where the filling material is. So that's how we were able to protect this tooth. If this area gets deeper, we'll go back and do that tooth as well.